Tattva. Our body is made up of 5 Mahabhutas according to Ayurveda. That is Agni, Vayu, Akasha, Prithvi and Jala. These 5 Mahabhutas work physiologically in our body in the form of Vata, Pitta and Kapha. Vata is air, Pitta is fire and Kapha is water. So 3 doshas work in the body and to maintain the balance between the 3 doshas is Swastha. Let's know more about Vata. Vata dosha is from the Vayu Mahabhuta and Akash Mahabhuta. So the qualities of Vata include Laghu, that is lightness, Ruksha, dryness, Khara, roughness, Shita, cold, and Chala Guna, the Vata has moving nature. It is responsible for all the movements in our body, respiration in the body, and all types of activities, thought process, everything. There are 5 types of Vata, that is Prana, Udana, Samana, Vyana and Apana. Now, let's move on to the causes which aggravate Vata. So, eating at the improper time, eating very less, Alpa Bhojana, Abhojana, not at all having food, Upavasa, doing fasting, and Shita Ahara, taking cold food, Ruksha Ahara, dry food, and Vega Dharana, that is suppressing the natural urges like suppressing the urine, motion, sleep, etc. Ratri Jagarana, awakening during the night, and Manasika Nidanas like Chinta, excessive thinking, Bhaya, fear, and Shoka, grief. All these factors causes aggravation of Vata in our body. The aggravated Vata moves through the channels in our body and causes some discomfort like pain, swelling, stiffness or cramps like that. Dehe srotansi riktani purayitva anilo bali karoti vividhan vyadhin sarvanga ekanga samshrayan. The aggravated Vata moves through the minute channels in our body and occupies in the empty spaces and causes different types of Vata Vyadhi. So the main Vata Vyadhis include Ardhika, Pakshagata, that is paralysis, and tremors. One among them is Sandhi Vata. Let's move on to Sandhi Vata, that is osteoarthritis. Osteoarthritis is a common disease seen in the elderly people. It is a degenerative joint disease wherein the flexible tissues at the ends of the bones gets degenerated and causes pain, swelling, stiffness, and then crackling sound in the joints. The main joints affected are knee joint, hip joints, and the lower back, and also the cervical joints. It increases, it is there all over the year and mainly increases in the winter season too. And it is mainly seen in the obese persons. If it is not treated properly at the proper time, then the person will have disability, that is he cannot move, he will limp, and then there will be and disability. Then if not treated, then there will be complete cartilage breakdown and there will be bone to bone contact and it causes more tenderness and pain. So to stop the progression of the disease, the person should maintain a healthy lifestyle, then proper weight management. He should start walking, doing pranayama, avoid climbing the stairs, yoga. So pranayama improves the quality of vayu in our body. Then yoga, that is sukshma vyayama to all the joints, that improves the blood circulation also in the joints. Then the person should avoid processed foods, oily foods, and alcohol, sugar, and high fat dairy products. He should use more of ginger, curcumin, jeera, hing, and lemon. The citrus content prevents the inflammation in the joints. Then the joint supplements to improve the joints like glucosamine, chondroitin, curcumin, that is our haldi, and Boswellia serrata, that is shallaki, and shigru, that is drumstick. Shigru and shallaki, they are rich in calcium, which improves the joints nourishment. So coming to Ayurvedic management, we have to control vata, that is the basic cause is vata. So in our food, we have to use little ghee, that is it helps in digestion and also in the lubrication of the joints and the flexibility of the joints. Then he should follow a healthy lifestyle. The vata abhyanga, for the external, he should do abhyanga, that is oil massage just before taking bath, 10 to 15 minutes before bath. He can apply oil and massage. The best oil is tila taila, and he can use other oils like Narayana taila, Dhanvantaram taila, etc. And our products like Sandhi Mitravati, the name itself says Sandhi Mitra, that is very good for joints. It can be taken 2 tablets morning and night after food. And Ospo C, that is calcium supplement, morning and night. Flaxseed oils, capsule, morning and night before food. And the curcumin, that is turmeric plus, which improves the immunity and prevents the inflammation of the joints. So these products can be taken. And in case if the person is suffering a lot, he can be advised some treatments like Janu Basti, Kati Basti, that is a well is constructed with a urad flour and medicated oil is poured over it and left for some time. So Janu Basti, Kati Basti can be done. Then Upanaha, that is fermentation, hot fermentation can be done over the joints. Then Parisheka, Parisheka is pouring warm water or the medicated kashayas over the joints. Then some of the panchakarmas like Sneha Virechana, that is the person is advised to take medicated castor oil, that is the home remedy, medicated castor oil, 2 spoons in warm water in the night time. And in the Panchakarma, that is the 7 days procedure, he is advised Sneha Virechana and Sneha Basti, that is the oil enema. So these two panchakarmas helps in eliminating the vata in our body, because vata is the main cause for this joint diseases. And the person is advised to do more of sukshma vyayama, and he's not supposed to climb up and jog or jump because it causes destruction in the joints. Mainly in the x-rays, it is diagnostic thing is x-ray. In the x-ray, it shows the degenerative changes in the bones. And in the extreme cases, MRI can be done. So these are the things related to Sandhi Vata. Now, we are having online consultation. So you can log on to the consultation thing. Through online, you can do consultation, WhatsApp video call. Any doubt, any questions? So the person should have khichdi diet once in a week. So khichdi diet without vegetables, with lot of jeera, pepper, ginger, haldi. It improves the digestion power. And he can practice also few mudras, that is Agni Mudra, that is like keeping like this near the umbilicus region. It improves the Agni. Then he can adopt Prana Mudra to decrease the, to energize the Prana Shakti, and Vayu Mudra, subsiding the Vayu Guna in the body. And he is advised to take more of warm water, jeera water, and kashayas prepared with amrit, bilva, tulsi, ginger, etc. And when he is doing exercises, he should not strain himself. Whatever the easy poses he can do, he should do. वातपूर्ण धृतिस्पर्शः श्रोतः सन्धिगते अनिले प्रसरण आकुञ्चनयोः अप्रवृत्तिश्च स वेदना. There will be swelling in the joints, stiffness in the joints, and there will be difficulty in the movement. Prasarana akunchanayoho. There will be difficulty in the flexion and extension of the joints, and there will be crackling sound in the joints. You want to ask any questions? So some more Vata Vyadhis are Kampa, that is tremors, Pakshaghata, paralysis, Ardhita, facial paralysis. So in all these conditions, the first line of treatment is Snehana, that is Sneha Amsha in Abhyantara Sneha, that is ghee, using ghee, and Bahya Sneha, that is massaging with the oil. That improves the circulation and promotes nourishment to the joints. So in the joint diseases, we have one more classification, Amavata. Amavata, that is rheumatoid arthritis. So there will be more of swelling. It aggravates during winter and it is caused because of the ajirana. And post-viral arthritis, that is arthritis related to after jwara or any viral infections, there will be pain and swelling in the joints. Then gouty arthritis, that is because of the excessive aggravation of the vata and rakta in the person, it causes gouty arthritis. There will be pain and swelling in the toes in the lower region. Yeah, arthritis is common in the vata person and depends on the lifestyle. If he takes more of vata kara ahara vihara, as I said, ruksha ahara, dry food, cold food, eating less, not eating properly, all these things, then arthritis will aggravate. It depends on the person, individual prakriti. Yeah, if Sandhimitra flaxseed capsule, then multivitamin supplements they should also one take. Yeah, it depends on the age factor. Multivitamins is also necessary for the body. He can take one capsule per day along with our tablets. If you have BP, then you can take your BP medications. Do more of meditation, pranayama. Yeah, what about the gas? So gas is also related to vata, that is flatulence we call. So we have to use more of hingu, that is asafoetida in our food. And in the first morsel of the food, that is the first morsel of the food, we should use hinguastika churna along with little ghee. Then it helps to relieve the gas. And some of our products, we have Pavanahara Churna and Pavanahara Vati, which helps to relieve gas. And also one person can sit in Vajrasana and also do Pavana Muktasana to eliminate the gas or the vata flatulence. Shakti drops. So Shakti drops can be used for the overall immunity. 5 to 6 drops in 1 glass of water. And if it's a child, 2 to 3 drops in water twice a day. And immunity boosters like Amrit, then Kabasura, Shakti drops, turmeric plus, all these things can be taken in this COVID times to boost our immunity. Live on benefits. So it improves the liver function, helps in metabolism, digestion. Very important herbs like Punarnava is there. It is very good for liver. Pranayama, as I said, Anuloma Viloma, that will improve the quality of Vata. The quality of Vata flowing in our body through different channels will be improved. So pranayama is a must. Instead of taking dava, that is medicines, we can do pranayama. We can take in hava. Any other questions? Dry fruits as considered as Vata aggravating. The dry fruits can be soaked overnight and then taken in the morning. It's not considered like aggravating Vata. Yeah, yoga asanas I already told. For gas, that is flatulence, Pavana Muktasana, Vajrasana. And for the Sandhi Vata, especially the joint diseases, whatever comfortable asanas for him, he should do slowly with guidance. Stretching, loosening, Sukshma Vyayama for all the joints. The more and more exercise or yoga you do, there will be joint flexibility will improve and he will be more active. Someone is asking about Brahmi. Brahmi is very good for the brain. It relaxes and calms down the mind. It improves the intellect, memory, helps in insomnia also. And Ashwagandha is overall nourishing, rejuvenating, mainly taken by the males, and Shatavari in the females. And if there is more stiffness, the person should not apply oil too much. The person should not apply oil, just a warm parisheka, that is warm water can be poured over it. And the person should not do sneha abhyanga at the night time. If a person does abhyanga at the night time, the condition will aggravate. So it is advisable to do just before bath, 10 to 15 minutes before bath. So all of you practice a healthy lifestyle, following dinacharya, that is getting up early, doing yoga asanas, pranayama, eating at the proper time, avoiding diva swapna, avoid daytime sleep, and do all the exercises and take the appropriate immunity boosters and consult your doctor through online. Stay home, stay healthy, stay safe. You can give Brahmi to child of 9 years in the half dosage, morning and night, consulting a doctor. Thank you.